My name is Paula Blackstein-Hirsch, and this webinar is about quality aims. Let's explore why these are the foundation for a quality plan. What is a quality aim? Quality aims articulate the organization's priorities for improving the quality of service delivery over a time horizon of approximately 3 years. They form the foundation for a quality plan over a 2 to 3 year time frame. Note that the quality plan gets refreshed annually as an organization works toward achieving the 3-year targets that are established in these aims. So, quality aims that are articulated for about 3 years, and then an annual plan that works towards achieving those 3-year targets. Most organizations focus on no more than 3 to 4 quality aims at one time. You might ask why. The reason is that a number of projects are required to achieve a 3-year aim, and most organizations simply don't have the capacity in terms of time or resources to support the number of projects that stem from 3 to 4 aims. Why are quality aims so important? And are they really necessary? You won't find a requirement for these in the guidelines for quality improvement plans. Nonetheless, I believe that they are a solid foundation for a good quality improvement plan. They translate the organization's strategic directions into focused improvement portfolio, both for staff as well as for others who are looking at your quality plan from the external world. You'll have a range of indicators, likely somewhere between 15 and 25 indicators. That's really hard for people to remember and to actually try to understand where the priorities within all of those are. So by articulating a few quality priorities to which many of those indicators would relate, it helps to focus where the priorities from a quality perspective are for the organization, and everyone can remember a few things. They also serve as a communication tool that allow each person in the organization to see how they contribute to the organization's priorities. And articulated properly, we'll know whether and when we've achieved our goals. That means that they're specific and measurable. Also, with stretch targets incorporated into a quality aim, established for a 3-year time horizon, they can really inspire and motivate staff to want to engage in improvement work. So let's look at a comparison of a typical strategic direction coming out of a strategic plan as compared with a quality priority that stems from or is the foundation for a quality plan. So a typical strategic direction or strategic goal might be to strengthen strategic partnerships with other health and social service agencies to provide more coordinated community-based care. A quality aim or priority that is linked to that and might evolve out of that would be articulated as, by March 31st, 2018, note that it's a 3-year time frame, we will improve the client experience with care coordination by 25%. So what's the difference? The quality aim is much more specific and measurable. I hope that you would agree with that. Don Berwick, who was the founding president of the Institute for Healthcare Improvement, stood in front of a large conference of 5,000 people about 10 years ago and made the statement, "Some is not a number, soon is not a time. Some is not a number, soon is not a time." And he challenged everyone to start articulating quality aims using 3 questions: how much, by when, as measured by. So let's take a look at the quality aim that was included on the last slide, and let's take it apart using those 3 questions. How much is by 25%? By when by March 31st, 2018, and as measured by is client experience with care coordination. Note that it's really, really important to ensure that this as measured by reflects one of the 5 dimensions of quality. These quality aims or priorities need to focus on something that clients and their family members care about and something that will be inspiring to staff. So just to give an example, if we had something related to improving the effectiveness of service delivery for clients with dementia, we would want to include a measure that actually related to something like decreasing the agitation of those individuals with dementia as they engage with volunteers from our organization, as an example. If the aim included something about volunteers as compared with decreasing the agitation of clients, that would not be reflective of one of the 5 dimensions. It would be more about the how than the what. So better to include something about the agitation of clients in this aim than to include a focus that relates to working with volunteers in order to improve the outcome for clients. So now that I've given you that example and we've pulled apart a quality priority using those 3 questions, what I'd like to do is provide you with the opportunity with looking at several quality aims and guessing as to whether or not the aim is good, bad, or ugly. So what do I mean by that? If it's good, how much does it align with those 3 questions? How much, by, when, as measured by? If it's ugly, it doesn't align with those at all. If it's good, it aligns really well. And if it's bad, it's somewhere in between. So let's take a look at the first one. We will improve access to service by 15% by March 31st, 2018. Is that good, bad, or ugly? If you selected bad, you were correct. And let's take a look at why. How much in this is by 15%, so that was good. By when is by March 31st, 2018, so that's good. The as measured by improve access is very vague. We really have no idea specifically what kind of access. Are we measuring the number of days from one specific time to another time? Are we measuring number of months? Are we trying to decrease wait time in days? Are we trying to decrease the number of people on a wait list? So we'd really like to see improving number of days from one point in time to another point in time in order for that to move from bad to good. Let's take a look at the next one. We will decrease falls resulting in injury by 20% by March 31st, 2018. Is that good, bad, or ugly? If you selected good, you were correct. Let's take a look at why. How much? By 20%, so that's good. By when? By March 31st, 2018, so that is good. As measured by falls resulting in injury. That is an outcome indicator. It's something that clients would care about. They don't want to end up with a critical incident that falls within the safe dimension of quality. So it's a good outcome indicator, something that clients care about, so that aim aligns with all 3 questions. Let's take a look at the next one. We will increase the number of volunteers over the next 2 years in order to decrease wait times for service. Is that good, bad, or ugly? If you chose ugly, then you're correct. Let's take a look at why. The how much is over the how much, sorry, there is nothing there in terms of how much. We really have no idea um, how much they intend to increase this by. The by when is over the next 2 years. The challenge with this kind of an articulation of time is that we have no idea when this aim was set. Somebody in the organization will know, but if I pick this up and look at it, I have no idea when this aim is intended to be achieved. So we want a specific date rather than over the next year or over the next 2 years. And the as measured by number of volunteers, remember we talked about wanting to include something that clients or their family members would care about. Clients don't really care about the number of volunteers in an organization. What they care about is not having to wait. So this is about decreasing wait times, but the focus here is increasing the number of volunteers in order to do that. The measure, which should fall out of the aim, should be about wait times, not about number of volunteers. So let's take a look at the next one. We will maintain the functional capability scores of clients from April 1st, 2016 to March 31st, 2018. Good, bad, or ugly? Okay, if you chose good, then you were correct. This one may not look quite as specific as some of the others that we identified as good, but it's actually okay. This aim actually focuses on sustainability, not on improvement, which is okay to include in a quality plan. Indeed, we know that sustaining results requires considerable effort. So let's take a look at the 3 questions. How much? Maintain is actually what we want to do. So as long as the target in the quality plan is the same as baseline, we can actually say maintain. The by when is from April 1st to March 31st over a 2-year period, so that's specific. And the as measured by is functional capability score, which is okay. That functional capability score will be different for every individual client, but as long as that individual score or the average for the organization is maintained, that's what we're trying to do. So the indicator for that kind of an aim would likely be something like the percentage of overall change in client functional capability score. So let's take a look at the next one. We will decrease wait times for service initiation for clients by 15% over the next year. If you chose that bad for that one, then you're correct. Let's take a look at why. The how much is by 15%. The by when says over the next year. So that's one of the reasons this didn't get good, because it's not sufficiently specific. It does not include a date. And the as measured by is wait time for service initiation. It would be even better if it specified a unit, like days or hours, and if it also specified when the clock started ticking. Is it from the time of referral? Let's take a look at the next one. We will improve client experience with service continuity by March 31st, 2016. Good, bad, or ugly? Again, I would rate this one as bad. Let's look at why. How much? There isn't anything in this aim that articulates by how much. The by when is by March 31st, 2016, and the as measured by is client experience with service continuity. Note that in specifying, this doesn't relate to the aim, but in specifying an indicator that would relate to this aim, it should be a bit more specific than the aim. It should actually include the category from a client experience survey, like the percentage of clients who indicate excellent experience with service continuity. Or you might choose the top two categories, very good or excellent experience with service continuity. And now let's look at what I believe is the last one. We will advocate for enhanced program funding to expand from 1 to 3 sites by March 31st, 2018 in order to address unmet needs, good, bad, or ugly. So this one is ugly. And the reason for this is, let's take a look at the 3 questions. How much? It's expanding from 1 to 3 sites, so that kind of gives you an idea of how much. By when? By March 31st, 2018, so that's good. The as measured by. Advocating for enhanced program funding is not something that clients will directly care about. They care about the program, receiving the program, but they don't necessarily care about how the organization funds it. Also, most improvement aims focus on projects that make change at the front line. This aim really is something that a board or senior leader would be actively involved in. It would likely be part of a strategic plan and something, as I said, that leadership would focus on, but not the kind of change that takes place at the front lines of care that actually impacts service delivery for an individual client. So just before we complete the webinar, let's take a look where in the quality plan templates quality aims can fit. As noted earlier, Health Quality Ontario templates don't specifically refer to the need for organizational quality aims. However, in the short form, which is the 2 to 3 page narrative of a quality plan, the quality aims can be inserted in the overview section. Remember again that this is a 1-year plan, so the quality aim will be repeated in a few quality improvement plans because these quality aims reflect a 2 to 3 year horizon and the quality plan is refreshed on an annual basis. So that ends our seminar or our webinar. Let's just summarize what we've covered. A good quality aim will serve as a bridge between the strategic plan and a quality plan. It's articulated as how much, by when, as measured by, and recall that it should reflect an outcome that is important to clients. And if articulated well, the outcome indicator will actually fall directly out of the quality priority or the quality aim. It supports the quality plan for a 2 to 3 year time horizon, and it can be included in the short form narrative template that gets submitted to Health Quality Ontario. So good luck with developing your quality aims that should serve as an important foundation for your quality improvement plan.